I actually decided to get into healthcare probably because I grew up with a mom as a nurse, and those were kind of my earliest experiences in healthcare, kind of hearing about it in general, visiting her work as a little kid and into her nursing job and meeting some people in that vicinity. And it always kind of just attracted me. I think as a kid, I didn't really know why, but as I got older, I really took a keen interest into the sciences and the health sciences specifically. And I probably one of the biggest things that I valued about being in healthcare is the chance to interact with people and make an impact on their lives. And as I've kind of gone through training, it's become more and more clear how much I love that part of the profession, and the ability to just team up with the patient, even to work through some of their health issues that come up, has kind of kept me engaged as I've gone through training and made more definite decisions on which areas of medicine I end up in. My specialty is rheumatology, and I would bet that you could find a whole host of different definitions from a variety of different people. But what I really think we do in rheumatology is we evaluate a person who may have concerns about arthritis or joint pains, and sometimes this also means muscle conditions or muscle pain, or even muscle weakness. Many of the types of conditions that can cause or be part of an arthritis type condition can be autoimmune diseases or inflammatory types of diseases. Arthritis is a common feature of many different types of autoimmune diseases, and so oftentimes a rheumatologist might be described as a doctor of autoimmune disease. Some autoimmune diseases are certainly treated or diagnosed by other providers or other specialties, but in general, rheumatologists are pretty well versed in conditions or disorders of the immune system. I decided to join the Iowa Clinic because of our people. That was something that became very clear to me as I began exploring what the Iowa Clinic was all about, and the people, no matter where I went, in the clinic, in the administrative offices, it was very clear people were interested in making this a very special place to work, and also with a focus on delivering really high-level healthcare, which is something very important to me. I think the interconnected system with primary care providers and multiple specialties really leverage that. One word that best describes me, I would say, is curious. That really speaks to my desire to really get to know somebody when they come to see me and really dig into what it is that's been going on and try and get a better understanding of what's actually happening there that can ultimately lead us to a more accurate diagnosis and a better treatment plan. When I'm not at work, I like to do a host of different things. One certainly is play some soccer, or watch soccer for that matter. But I enjoy reading, I enjoy learning, so I could be learning in medicine, but also a host of other things that catch my interest. And probably the most important thing right now is my young child and my wife and our puppy, that we have a lot of fun together, so I try to dedicate as much time as I can outside of work with them. I hope that patients gain, after a visit with me, a feeling of connectedness and understanding in regards to what's going on with them, what has been going on, and what we can do to try and help, one, make them feel better, but also figure out what's going on. Oftentimes, people come to me with still that in question, and it's an important piece to directing the right treatment at the right time.